Welcome back, coders, to another fast-paced explainer right here on Decode Healthcare with Harshal. I'm your host, Harshal, and today we're jumping straight into part 74 of our 100-part series, breaking down the ICD-10-CM official guidelines. Today's mission? We're unlocking the highly technical CMS rulebook for Chapter 7 and 8. That's the eye and the ear. We're going to master glaucoma, 7th character staging, untangle those tricky bilateral cataract rules, break down hearing loss types, and look at aggressive secondary code stacking for otitis media. It's all zero fluff, just purely compliant coding strategies to keep your claims completely clean. Let's get into it.
Okay, let's dive right into today's playbook. First up, eye and ear coding laws. Then, glaucoma staging bilateral rules. Number 3, cataract laterality and etiologies. 4, hearing loss classifications. And finally, otitis media code stacking.
Section 1, Eye and Ear Coding Laws. We're looking at Section IC7 and IC8 of the CMS Guidelines.
Section 2, glaucoma staging bilateral rules. Navigating Category H40.
All right, Category H40 for glaucoma. This is where 7th characters and strict bilateral rules absolutely trip coders up. Precision here is literally everything. The CMS rules demand exact laterality, distinct etiology, and precise clinical staging. To capture the exact progression, you absolutely must memorize these H40 7th character staging laws. Let's drill these in right now. 1 is mild, 2 is moderate, and 3 is severe. Easy enough, right? But pay close attention to 4, indeterminate stage. The guidelines explicitly state that you use indeterminate when the stage cannot be clinically determined based on the documentation. Do not, and I mean do not, confuse this with character 0 for unspecified. 0 just means the provider didn't document it at all. Huge difference there. Okay, let's test your reflexes with a quick micro scenario. You have a patient presenting with bilateral glaucoma. But wait, it's documented as stage 2 in the left eye and stage 3 in the right. Think fast for a second. How many codes do you actually need to accurately report this encounter? Well, what's really interesting here is exactly how the CMS guidelines strictly dictate your claim structure based on that staging. If both eyes have the exact same type and the same stage, you just assign one bilateral code with that specific 7th character stage. Simple. But in our scenario, where the stages are different, that bilateral code is totally thrown out the window. You have to assign 2 distinct codes, one specifying the left eye at stage 2 and another completely separate code specifying the right eye at stage 3. It's a non-negotiable bilateral coding law. You gotta get that right. Section 3, Cataract Laterality and Etiologies. Mastering categories H25 and H26. So, just like glaucoma, cataract rules strictly mandate that you specify laterality, right, left, or bilateral. But cataracts introduce another massive compliance hurdle, and that's etiology. You've really got to contrast the coding path for a standard age-related cataract against the super strict rules for a diabetic etiology. If a patient comes in with a standard age-related nuclear or cortical cataract, you just use your standalone H25 or H26 codes. No problem. However, if that patient has a diabetic cataract, well, Chapter 4 guidelines suddenly collide with Chapter 7. You are flat out required to use a combination code. And when you're structuring that claim, the diabetic combination code, E11.36, strictly takes the lead. It completely overrides and eliminates the need for any standalone H26 cataract code. That one combination code single-handedly reports both the underlying diabetes and the ophthalmic manifestation. Boom, one code, perfectly compliant. It really doesn't get much cleaner than that. Section 4, Hearing Loss Classifications. Distinguishing Category H90. Shifting gears over to the ear now. Selecting the correct H90 code hinges entirely on knowing exactly which anatomical pathway is disrupted. Let's break it down. Conductive hearing loss involves a physical sound blockage in the middle or outer ear, so think fluid buildup or bone abnormalities. Sensory neural, on the other hand, involves damage to the inner ear or the actual nerve pathways leading to the brain. And mixed, well, as you'd probably guess, that's a combination of both. You absolutely have to extract this exact terminology directly from the provider's documentation. No guessing allowed. But listen, just knowing the type of hearing loss isn't quite enough. The logic for H90 requires you to specify unilateral versus bilateral. And here is the real kicker. For unilateral hearing loss, the status of the opposite ear is a totally non-negotiable factor in your code selection.
The codes will literally ask you if the hearing in the opposite ear is normal or unrestricted. So you must always verify that opposite ear status right there in the chart.
Section 5. Otitis media code stacking. Categories H65 to H67 and environmental exposures.
Otitis media coding is heavily dependent on differentiating between acute versus chronic. You also need to know if it's suppurative, which means with pus, versus serous, meaning clear fluid. But there is a hidden trap here, and it involves environmental exposures. Check out this highly practical micro-scenario you'll probably see every single day in pediatrics. A child is diagnosed with acute supraerurative otitis media. The provider also notes that the child is exposed to passive smoke at home. Now, if you only code that ear infection, your claim is incomplete. So what's missing?
The crucial point here is that you must aggressively stack that secondary Z code. The guidelines actually dictate a mandatory use additional code note for exposure to environmental tobacco smoke, that's code Z77.22. Or if it's an adult patient, it might be a history of tobacco use, which is Z87.891. That secondary Z code is absolutely crucial because it paints the full clinical picture of the risk factors complicating the patient's recovery. And trust me, CMS expects to see it right there on the claim.
And just like that, we've powered through the absolute most critical eye and ear laws. Huge congratulations to you for surviving this fast-paced explainer. You have successfully mastered glaucoma 7th characters, those strict bilateral cataract rules, hearing loss laterality nuances, and of course, otitis media Z-code stacking. If this explainer helped clarify the CMS guidelines for you, make sure you hit that like button and subscribe to Decode Healthcare with Harshal so you never ever miss a coding mission. But hey, don't get too comfortable because we are really just getting started. Next up in Part 75, we are taking on a massive heavy hitter, Chapter 9. Are you ready to master the highly complex rules for the circulatory system? We're talking hypertension, coronary artery disease, and heart failure rules. It's going to be intense, it's absolutely essential for your coding career, and I will see you there.